Hello and welcome to Intuition Study Hub Smart Video Cardiovascular System, and we are going to see the important signs in the cardiovascular system. Alfred Demusset sign. Bobbing of the head with each heartbeat. The rapid blood flow in the carotids will push the head with each beat, thus leading to the movement of head up and down with each heartbeat. Alfred Demusset sign. Alfred Demusset sign. But the movement should be up and down. Alfred Demusset sign. Auenbrugger sign. In pericardial effusion, an epigastric prominence is seen. Auenbrugger sign is seen in the pericardial effusion, epigastric prominence. Auenbrugger sign. Branham sign. Branham sign is seen in arteriovenous fistula. The swelling due to arteriovenous fistula disappears on applying pressure on the artery proximal to the fistula. Thrill and druid will decrease and the pulse rate falls. The pulse pressure will return to normal after that. That is called Branham's sign. Branham's sign is seen in AV fistula, the swelling. A pressure applied above the swelling. Remember, Branham's sign. Cardarelli's sign. Cardarelli's sign. Transverse pulsation in the laryngotracheal tube in aneurysms and dilatation of aortic arc. Transverse pulsation in the laryngotracheal tube in aneurysms and dilatation of aortic arch. This is Cardarelli's sign, pulsation. But it's transverse pulsation because the arch of aorta is like this. And the pulsation should be like this. Transverse pulsation. Cardarelli's sign. Carvallo's sign. Carvallo's sign in case of ASD, atrial septal defect. The tricuspid murmur is maximal at the lower sternal edge and increases in intensity during inspiration. The case is ASD. What is the type of murmur? Tricuspid murmur, where you will auscultate at the lower sternal edge. And when does it increase? Increases during inspiration. That is Carvallo sign. Where do you auscultate? Lower sternal edge. In the case of ASD, Carvallo sign. Corrigan sign. Corrigan sign is dancing carotids and aortic regurgitation. Dancing carotids. It's dancing. It's a carotid. That is called Corrigan sign. And the case is aortic regurgitation. Yes. Delbet sign. Aneurysm of limb's main artery is Delbet's sign. Aneurysm of limbs. Limbs, it includes both upper and lower limb. Limb's main artery. Delbet's sign. Dressler's sign. Dull note in the lower part of sternum in pericardial effusion is called Dressler's sign. What note? It's a dull note. Dull notes. It's a dull note in the lower part of the sternum. That is called Dressler's sign. Evart's sign or pin sign. Evart's sign is seen in compression collapse of the basal segments due to large pericardial effusion. What is the condition? Pericardial effusion. There will be dullness on percussion, increased vocal resonance, tubular breath sounds, increased vocal resonance and bronchial breathing are seen in cardiac tamponade due to pericardial effusion. What to remember? Pericardial effusion and dullness on percussion. That is the main point here in Edwards sign. Pericardial effusion with dullness on percussion with tubular breathe sound. The tubular breathe sound. Edwards sign. Ewing sign is a pericardial sign. Ewing sign. Fagot's sign is seen in yellow fever. Relative bradycardia is present from the second day of illness, that is Fagot's sign. Bradycardia in yellow fever. Bradycardia, slow heartbeat. Bradycardia in yellow fever. Fagot's sign. Fat pad sign is seen in pericardial effusion. In normal persons, the parietal pericardium is separated from epicardial fat but by about 1 to 2 millimeter. This is increased in pericardial effusion. What is fat pad? The pad is fat. The pad is fat. The pad is fat. Fat pad sign, and it is seen in pericardial effusion. Felsen's Siloid sign, or it's most commonly called as Siloid sign. Any intrathoracic mass touching the heart, aorta, or diaphragm will obliterate that border on the chest X-ray. So, Siloid sign is seen in chest X-ray. In which condition? Any intrathoracic mass. What is the sign? It should touch the border and obliterate the chest border. Yes, that is Siloid sign. You can see the chest border got obliterated because of the huge intrathoracic mass. This is Siloid sign. The border completely obliterated. Siloid sign. And next, flying W sign. The posterior mitral leaflet movement resembles the letter W. In partial systolic closure of pulmonary valves, there will be a flying W sign. What to remember? Two things. Which leaflet? Mitral leaflet. And which condition? When there is a systolic closure of the pulmonary valves, and the closure should be partial closure. Yes, in that case you will get flying W sign. Yes. Next is Frederick's sign. Increased jugular venous pulse with sharp diastolic collapse. Rapid wide descent in pericardial effusion. Frederick's sign. Frederick's sign is related to JVP. Okay. JVP is increased or decreased? It is increased in Frederick's sign. And there will be rapid wide descent. What is the condition? Pericardial effusion. That is Frederick's sign. Yes, this is the one. JVP. Greisinger's sign is seen in lateral sinus thrombosis. The thrombus may extend and result in indurated tender area over the upper part of internal jugular vein and mastoid region. So, what is the condition? Greisinger's sign is seen in lateral sinus thrombosis. And when you see the patient, how you will recognize? There will be a tender swollen region in the upper part of the internal jugular vein, that is which is actually inside, and in the mastoid region, that is Greisinger's sign. Here is the internal jugular vein. You will have an tender indurated part which extends also affects the mastoid region, that is Greisinger's sign. Homan's sign is positive in venous thrombosis. Tenderness can be elicited indirectly by forcible dorsiflexion of the foot with knee extended. Yes, what is the condition? Venous thrombosis. How you will do this? You have to forcibly dorsiflex The foot with extended knees, in that case, tenderness is felt. That is Homan's sign. Inverted mustache sign. It is seen in X-ray chest in the congestive cardiac failure. So it is an radiological sign, X-ray chest. And the condition is congestive cardiac failure. This is how it looks. So these are the mustache, the inverted mustache seen in congestive cardiac failure. Knuckle sign. It is seen in vessel occlusion due to thrombosis. There is an abrupt tapering of the vessel distal to the occlusion. Knuckle occlusion. Knuckle occlusion. Why? Due to thrombosis. And what happens? There will be a tapering of vessel distal to the occlusion because there is no blood flow. That is called knuckle sign. Tapering of the blood vessel distal to the occlusion. Knuckle, there is an occlusion because of thrombosis. Lambda sign, small ascending aorta seen in hypoplastic left heart syndrome. What is the condition? Hypoplastic left heart syndrome. And what do you see in that case? There is a small ascending aorta, and the sign is called lambda sign. Ascending aorta, but it is small. Lambda sign, hypoplastic. It's hypoplastic left heart syndrome. Left heart syndrome. Aorta. Lambda sign. Landolfi sign, constriction and dilatation of pupils with the heartbeats and not related to the right reflex. Okay, there is a dilatation and constriction of pupils with a heartbeat, but it is not related to the light reflex. It is called Landolfi sign. Constriction, dilatation related to the heartbeat, like lop, dop, lop, dop, lop, dop, is Landolfi sign. Lighthouse sign, alternate flushing and blanching of the forehead in aortic regurgitation. It is lighthouse sign. Lighthouse sign is seen in aortic regurgitation. There will be alternate flushing and blanching of which region? Forehead. Yes, that is lighthouse sign. Flushing, blanching, flushing, blanching of forehead. Lighthouse sign. Melting sign. In pulmonary embolism with infarction, the consolidation regresses from periphery to the center. That is called melting sign. Melting sign is seen in pulmonary embolism with infarction. So, the consolidation regresses from periphery to the center, just like the ice melts from the periphery to the center. The consolidation regress from the periphery to the center. That is melting sign. Muller's sign, pulsation seen in uvula in aortic regurgitation. That is called Muller's sign. The pulsation in the uvula. Muller's sign. Which condition? Aortic regurgitation. Muller's sign. Nash's sign, increased pulmonary blood flow in moderate and severe VSD, ventricular septal defect. That is called Nash's sign. Increased pulmonary blood flow. Nash's sign. Increased pulmonary blood flow. Nash's sign. To be continued in next video. Happy learning from Intuition Study Hub.